Hi, welcome to Glow Up with Dr. C. I'm Dr. C, a board certified pharmacist and medication therapy expert. And today we're going to cover some of the top weight loss drugs in America that I feel I'm just going to give you the tea on, and just help you to understand a little bit more about some of the drugs that you might be on, or someone is taking, or either you're thinking about starting. So if this interests you, go ahead and stay tuned. I do wait to the end. Go ahead and watch it to the end, and I'm going to give you another non-medication way of losing weight that I think you'll love and enjoy, and it's actually more effective than any weight loss drug that you could ever imagine. So if you stay tuned, just watch to the end. Obesity is an epidemic in America. We have so many different illnesses that come from obesity, like diabetes, hypertension. It definitely is a problem here in the South. I'm in Mississippi, and I know that we kind of glorify voluptuousness and a little bit of meat on your bones, a little bit of what they call pushing for the cushion, or cushion for the pushing, or whatever, what have you. So it's definitely glamorized here in the South. However, it is the precursor to a lot of other serious health conditions. The reason that this topic is very important to me is because I actually have been on the other side of obesity, not able to breathe sometimes. I think my highest was, when I was pregnant, my highest weight was about 285. Being that big and just being unhealthy and not able to really participate and engage in my children's life, and also just the effect it had on me mentally, not feeling good about myself. So it has affected me, and I had to also, do things, find an alternative way of losing weight healthy, safely. That this is not medical advice. This is just for educational purposes. Definitely seek your own health provider, because this information, you want to make sure that it's tailored to fit you, your lifestyle, and whatever condition that you have. In general, the ones that I'm going to share with you are meant to either help suppress your appetite, to regulate your insulin, or overall just to help produce a stronger metabolism so that you're able to burn a lot of fat and calories as well. With all of these medications, it's very important to, also consider your diet, increase your exercise, and lots of water. Don't just think that these medications are going to be the magic solution to weight loss, just a one-stop shop. They're supposed to be in conjunction to a healthy diet, exercise, and your increase in water intake. The first one I want to talk to you about is Phentermine. Phentermine has been out for ages, I would say over at least 10 years, and this drug is mainly used to suppress your appetite and also increase your metabolism. It pretty much targets the central nervous system, so you're having appetite suppression, and also it increases your metabolism. One of the reasons that Phentermine is so attractive is because it's very cheap. It costs little to nothing to purchase. Most insurances cover it, and it can be most effective short term, meaning that it's actually supposed to be used as a jump start. That's why when you start taking it, your body starts to you start to feel your heart rate starts to increase. And normally the doctors check your heart rate and your blood pressure because of that heart, rate increase, as well as it reduces your appetite. And so you're starting to burn more calories, and as well at the same time you're starting to consume. So that's why it's so effective. Now the cons of it is that it can cause you to stay up during the night. So with this medication, the doctor usually wants you to take it in the morning, as soon as you wake up, right before breakfast, and wait about 30 minutes. Also, it increases your heart rate, of course. So you might during the course of the day feel, a little bit of your heart racing a little bit, and which in turn can make you anxious. And also with this medication, you don't want to be on it for more than 3 weeks. As a matter of fact, after about a month, it loses some of its effectiveness, and then you kind of go into where they call tolerant phase, where it, you still have that. A lot of people think of it as it's kind of becomes like an Adderall, where it makes you a little bit sharp, but you don't have the weight loss, the appetite suppression goes away, and you're just taking it to take it. So with that, normally a doctor will tell you to just stop taking it for about a month, and then try it, probably a month or two later. This is usually the best for younger audiences, younger candidates who are obese, mainly in their 20s and 30s, who don't have problems with heart problems, and are, more active and can get out and, exercise and do things of that nature to, help the medicine work better. Now, the second one I want to talk to you about is Mounjaro, also known as tirzepatide. Now, this came out probably a few years ago, and recently another drug that's just like Mounjaro, called Zepbound. They're the same exact drug. However, Mounjaro was so hard to be approved for a lot of people who are obese but don't have diabetes. So that's why they have Zepbound. Insurance companies more than likely will approve the Zepbound, because Mounjaro is also considered a diabetic medication. Very effective, can be used long term, and it helps to regulate blood sugar as well as suppress the appetite. With that being said, one of the pros of taking Mounjaro is that it is effective for weight loss control, very much effective for weight loss control. You can see up to 10 to 20 pound weight loss within a month because of that appetite suppression. And then also it regulates blood sugar control, which we know that when you have low blood sugar, you want to eat more. It makes the cravings come more. So when you're on Mounjaro, you'll realize you don't have as many cravings for any type of sugar product, as well as you don't want to eat as much. So that's why a lot of people who are taking Mounjaro or Zepbound, they tend to lose weight a lot quicker when they've had those types of problems with controlling their craving. Now, the con of Mounjaro, it does cost a coin. It retails over about $1,300 cash price. Sometimes insurance can bring that down to $500. And I know Mounjaro and Zepbound, if you go to their website, they do provide a voucher that could bring the cost even more to $25 or of no charge. So if you're taking Mounjaro or Zepbound, make sure that you go to their website and type in your information and get that voucher. Take it to your pharmacy, and it does bring down the cost even more. Ideally for Mounjaro, you want to have a patient who, or you want to be a person who also has diabetes as well as obesity, type 2 specifically. And this is more what patients, those types of patients will benefit the most from Mounjaro, because it has that dual blood sugar control. A lot of my patients have said that they weren't able to really control their blood sugar until they went on Mounjaro. So, and then Zepbound as well has that same effect, but it is FDA approved for just weight loss. That I wanted to talk about is the Ozempic, also known as semaglutide, and its counterpart, which is also just like Mounjaro. Its counterpart is specifically targeted for patients who are only seeking to lose weight and don't have diabetes, which is the Wegovy. So Ozempic and Wegovy are the same drug, except for Ozempic is for patients who are type 2 diabetes, and then Wegovy is for patients who are just obese. So this is also a medication that is used to reduce the appetite and to improve the sensitivity of insulin, meaning that insulin is a hormone that helps to bring glucose into the cells, and so it's taking it out of the blood. Once you have so you're also able to, by that way, regulate your blood sugar just like the Wegovy, but it's just a little bit better at, you know, improving insulin sensitivity. And so it has been shown that Wegovy is just as effective as the Mounjaro. However, the Wegovy can be increased to a higher strength than the Ozempic and the Mounjaro. So if you become tolerant, the benefit of the Wegovy is that if you become tolerant at a certain strength, you can increase it. Your doctor can increase it to a higher strength, higher than the Ozempic and Mounjaro medications. But the only thing about the Ozempic and Wegovy is that you do have that nausea and vomiting. That's why a lot of your pharmacists, when you come to see me at the pharmacy, the first thing we're going to ask you is, have you been on the smallest dose, which for Wegovy is, I believe, 0.25, and the Ozempic, the smallest dose is also 0.25 to 0.5. So the reason we ask that question is you want to at least be on a small dose for at least 2 weeks. This is also dosed once weekly. It's an injection that you dose one time a week. But if you skip those smaller doses, then you actually put yourself at risk of nausea and vomiting, nausea and the constipation. And I forgot to mention that the Mounjaro causes more diarrhea than the Wegovy, and the Wegovy causes more constipation than the Mounjaro. So take that into account. If you're someone who has a problem or issue with going to the restroom, you know, having bowel movements on a daily basis, you might want to go to Mounjaro and Zepbound. Whereas if you're someone who's, you know, constantly can't control or incontinent and can't control going to the restroom, you go often, you might, you know, want to try the Ozempic and Wegovy. That would probably be a better fit for you. One of the cons of Wegovy, it does cost, you do have to be injected once a week. A lot of people don't like injections, so they like to opt for the Phentermine, also known as the Adipex. So there you are with that one. Also, just want to let you know, a lot of my patients come back saying that they're not able to go to the restroom, have bowel movements. So I do recommend, there is what's called Lasso Tea. I don't know if you ever heard of it. I follow Storming Wellington. She's like a motivational speaker, and sometimes I listen to her, and she talks about Lasso Tea. That's something that she actually promotes on a lot of her videos, is the Lasso Tea in the NutraSweet, NutraBite, NutraBurst. But the Lasso Tea is very effective for combating that constipation. The last drug I want to talk about that is very popular is Qsymia. Now, Qsymia is a 2-in-1 drug. This is the only one on this list that has 2 medications in one product. So, but it is covered by most insurance, and so it costs little to nothing, which is one pro of Qsymia. Qsymia has Phentermine and another drug also known as a anti-seizure drug called Topiramate. Brand name is Topamax. Now, this combination, they learned about Topiramate causing appetite suppression because a lot of the seizure, they noticed that a lot of the patients who were on it for seizures were also losing weight very rapidly, and it's because they didn't have an appetite to eat while taking the Topiramate. The pro of Qsymia is that it can be used forever. It is approved for long-term use for weight loss control, because Topiramate is used long-term for a lot of seizure patients. So, and it's very effective. A lot of people lose a lot of weight of taking Qsymia. Is that Topiramate, if you stop taking it, unlike all the other drugs, if you stop taking Topiramate, it can increase your chances of actually having a seizure when you've never had a seizure before. So I urge people to be careful. If you have to take that drug, you have to be tapered off of it, and your doctor has to be the one to do that for you. Don't do it yourself. Let them give you the schedule, and just come see me. Now, ideal for patients who have seizures, you can have that Topiramate with Phentermine, and then also the Phentermine is increasing the metabolism and helping suppress the appetite, as well as the Topiramate. So I would think of someone who has problems with seizures to be on Qsymia, to add to their weight loss journey. Someone who's obese and also has seizure activity would be the ideal candidate, of course. But you could take it if it is approved for obesity, so anyone can take it. But if you're going to take it, be very aware of the cons of taking that medicine. Now, any of these medications, just be mindful and consider, do you have hypertension? If you have hypertension, you want to stay away from Phentermine and Qsymia, because that Phentermine can increase your blood pressure, increase your heart rate. Also, you want to be mindful of any heart issues, as well as if you have any mental health issues, you might want to stay away from the Topiramate. So, and you might want to look to just taking the Phentermine or the Mounjaro or Wegovy. And like I said, if you have any constipation issues, you probably want to stay away from the Wegovy injections and go to Mounjaro. Now, if you have any diarrheal problems and you're going all the time, Wegovy is probably your best friend. Also, you want to just look at any type of, what does your insurance cover? That's probably going to be ideal for you. A lot of insurances cover Adipex. It's a long-term drug, the Phentermine. A lot of insurances are now covering Wegovy. Majority of the insurances are covering Zepbound, and I believe a lot of insurances, from my knowledge, are covering Qsymia. But like I said, if you're on the injectables, definitely go to their website, Wegovy.com, Zepbound.com, and Mounjaro.com, and go and sign up for their program so they can give you those vouchers, so that you're not while you're learning about the product and starting to take it, you're not paying so much money. You can even get these vouchers even if you don't have any insurances, and it'll still be about $250 to $500. So it can be half off if you don't have any insurance. And always consult your doctor to make sure that these medications will be not only effective for you, but they'll be safe for you, because they have so many different side effects. And like I said, side effects are very specific to each patient. Not all patients are going to experience the same side effects, and not all patients are these medications going to be effective for. Always think about a good healthy diet and exercising. For weight loss, they want you to do 60 minutes most days of the week. For maintenance, 30 minutes. A lot of people think that 30 minutes a day or 30-minute run is okay, but no, if you're doing weight loss, you have to increase it to at least 60 minutes. You can chop that up throughout the day however you want to. 20 minutes in the morning, 20 minutes in the afternoon, 20 minutes in the evening. However you want to chop that up, you can, but 60 minutes most days of the week. Now, setting expectations for a weight loss goal, they usually recommend 1 to 2 pounds per week. Well, some of these medications will actually cause you to lose more than that if you've never been on them. I don't want you to freak out when you're losing about 5 pounds a week or even 10 pounds a week, because your body also sheds water weight initially. So you can lose 10 to 15 pounds of water weight and then start, shedding fat before you even get to the, shedding of fat. So just be mindful of that if you start to see rapid weight loss. But if you're starting to lose significantly, immediately talk to your doctor, because they might have to change the regimen of your therapy, or there could be something underlining, another underlying issue that they need to talk to you about. As you've stayed to the end, I do want to encourage you to avoid all of these medications. Why would I say that? And I've just talked to you about, because I know that a lot of us are very anxious about losing weight. We just want to lose weight so bad, and I understand that, because you don't feel good in the skin you're in. You want to get out, you want to try on those new clothes, you want to be that person, that it girl. I understand. This is a safe space for you. You could talk about it. You could be real with your girl. So I understand that. I know, like, for me, when I was very much obese, it did take a toll on my self-esteem. I felt like I was, not as valuable, not valued enough, even though I shouldn't have thought that way, knowing that God made me valuable, and He made you valuable as well. No matter what you look like, the shape, the size you are in, you are valuable. God made you enough, and you're exactly where you're supposed to be at. I know that a lot of us don't believe that, and so when we see ourselves in the mirror, it does, make us not want to be social. You want to be in the house, you want to cover up, and I understand that completely. So we do what we have to do, and some of us, we do have to just get that first 10 pounds before we can start feeling better and going to the gym and just engaging and socializing more. I understand that. I do want to talk to you about some of the programs out there that can help support you if you choose to not, you don't want to do the medication, you don't, want to, bother with those things. I actually was in one of these programs I'm going to talk to you about, and that is foodaddictsanonymous.org. There are programs out there that help you get off of addictions to food. A lot of people are addicted to sugar. I myself, I love chocolate. I could eat a whole bag of Lindor. That's my favorite, Lindt chocolate. Those balls with the chocolate in my favorite. I can go through a whole bag of those. And when I'm feeling low, I like to go for chocolate. Chocolate is, when I'm on, you know, that time of the month, I like chocolate. That is one of my I would say addictions that I had to kick. I don't really eat chocolate that much because I love chocolate, so I know I have to stay away from that. Well, I needed help to stay away from things like that, so I did Food Addicts Anonymous. And when I tell you, I have never come across people who are so kind, understanding, and who just understood the struggle of kicking the habit of eating flour, eating sugar all of the time, just to soothe, to comfort. They were the only people who really showed me that my comfort was in God. And even though I was, you know, very much, I'm a spiritual person, I'm a Christian, and I was very spiritual before, I had never been as spiritual as I was being in Food Addicts Anonymous. There are other programs for people who have sugar addiction, people who have addiction to breads and pastas. There are other programs. This is the first one I found when I lived in Charlotte, North Carolina. There are many meetings to go to. They also have Overeaters Anonymous, which a lot of people say they do well in that program. All these programs are free. It's a 12-step program for food addicts. They're also a program called Gray Sheet. They also have Food Addicts FAA, which is Food Addicts Anonymous something. But what I'm saying is there are other programs that are free to you. They help you to come off food, and they help not only for you to come off of eating and the cravings and to destroy, you know, that addiction, those cravings, but they also help you mentally to guide you through life, because a lot of us are extremists. We overthink. We don't like to say what's on our mind, so therefore we eat so that we don't have to speak how we feel, because we feel like our feelings are not valued, we're not valuable. So we eat instead of saying, hey, you treated me like this, I didn't appreciate it. Will consume. So these programs are there for you for free. You have a person you can be accountability for, and also there are meetings where you can see other people who share your same struggles, who share your same pains and frustration, and you can also see them overcoming. So with that being said, I just want to share that with you. I'll also list their information in the description. If you enjoy this content and you want to see more of it, go ahead and like, share, and subscribe. Also, leave a comment about some of, you know, things that you struggle with eating, whether you're struggling with getting that strength and energy just to go to the gym, or even some tips and tricks that you might have to share with the community. I want to hear from you. Also, just remember just to be safe with any of these recommendations, and stay blessed, stay humble, stay grateful. I'll see you soon. God bless.